Well, it's a double-edged sword for COVID milestones today. The U.S. reaching a grim number of deaths from the virus, but it also marks 1 year since the first person here in California got their first dose of the vaccine. 23 ABC's Maithili Gubi joins us at the Live Center with an in-depth look at where we stand with COVID-19 vaccines, cases, and hospitalizations across the state and here in Kern County. Maithili.
So 800,000 people have lost their life to COVID-19 across the United States. Here in California, nearly 75,000 people have died and a little over 1,800 have lost their lives here in Kern County. But experts say that our biggest tool against this virus is vaccinations. And it's been a year since the first dose was given right here in California.
We want to celebrate the 1-year anniversary of the first shot in a California arm. Since then, 61.5 million doses, 200,000 booster doses per day right now.
And here in Kern County, the first vaccine was administered on December 17th to medical professionals at Kern Medical. Since then, the county has given out nearly 990,000 vaccines. That's about 50.9% of the eligible population over 5 being fully vaccinated, and about 57.6% are partially vaccinated. Those numbers come from Kern Public Health.
Over 95,900 doses have been identified as either an additional dose for those who are immunocompromised or a booster dose, meaning that 22% of our fully vaccinated population is boosted.
But officials say statewide since Thanksgiving, they have seen COVID cases rise by nearly 47%, and hospitalizations have risen by about 14%.
So we're not surprised to see an increase in cases and hospitalizations. In fact, we anticipate some more leading into a winter surge.
That's why the state implemented the indoor mask mandate. But Dr. Rohan Radhakrishna with the California Department of Public Health adds that this is only as useful as people follow the guidelines.
You don't wear your seatbelt because the sheriff may enforce it or because it's the law necessarily. You do it to protect your health, that of your passenger.
Dr. Radhakrishna says this temporary mandate is especially important during the winter time, with more Californians gathering and traveling.
The mask mandate is life-saving, hospital capacity preserving, inconvenient, and something we wouldn't do unless we thought it was absolutely necessary.
And even with the Omicron variant already detected in California and increasing across the country, Dr. Radhakrishna says we have more ways to protect ourselves now with vaccines, boosters, and expanded testing.
People should be more confident than ever with the tools in our toolbox as long as they're using them.
And according to Kern Public Health, there are 3 potential models for our COVID cases right here in Kern County. According to the best case scenario, hospitalizations bottom out by about May of next year. In the moderate case scenario, there will be a small surge peaking with about 120 cases in the middle of March. But the worst case scenario shows that we could peak with cases by the end of February with over 1,000 new cases and hospitalizations after that. But it's unclear which way we're going now, and a large part of that is going to depend on the possible winter surge coming our way with cases and hospitalizations. At the Live Center, I'm Maithili Gubi, 23 ABC, connecting you.